Hello and welcome to this edition of Your Health, Your Wealth. I'm your host, Dr. Eddie Patton, and this is the first episode of 2026. I hope everyone had a wonderful, joyous, relaxing holiday season and are ready and geared up to really go into 2026. I'm excited about 2026. There were a lot of things that I personally am going to take away from 2025. It was certainly a year of ups and downs, a lot of things to be excited about, including this podcast. So I'm geared up to continue into 2026, keep providing content and relevant information, and keep pushing forward. So really excited about moving forward. And so what I wanted to do this first episode of 2026 was reflect a little bit on 2025, but also look at what are some of the big things in healthcare going into 2026. Kind of a layout of some different things that we'll focus on in the new year. My goal with the show is to make it more personable in 26, to look at a lot of these healthcare issues that are really affecting everyone's bottom line when it comes to your health, your wealth. And also, do more interviews, look at personal stories, because what I've gotten from feedback from listeners is that they take a lot away from the personal stories, the interviews that we've done here. So I'm stoked to be back here in the studio and getting ready and strategizing for 2026. Today, I want to walk through just a couple of things. Certainly within the news, we've been hearing a lot about these premium increases in 2026. And I also want to give a layout on something that you'll probably be hearing a lot about in 2026. And we'll certainly focus on in this show as well. And that's artificial intelligence, and how artificial intelligence, it's really making its way into the healthcare field. So last year, early in the show, we were a lot more broad with these big topics, but we'll start to go in and dive a little bit deeper and just giving a little bit more information about what's been going on in politics when it comes to the premium hikes. What are some of the things that we can expect in 2026? Some of these hot button issues that you may be hearing about, certainly in the first quarter of this year. So you start the year off, you open your healthcare renewal letter, and you see that, you've got the same coverage on your healthcare, same doctor, you're on the same medications, but now your premium has increased by double digits. The amount that you're going to be paying every month has increased. At the same time, the health plan that you're using swears that now they're using this cutting edge AI technology. It's saving money. It's being more efficient and helping you as the customer of the healthcare plan. So how does this work? Like who exactly is winning and what's wrong with this situation? So hopefully we can dive into that a little bit more and figure out some of the things that we can be looking out for as we start this year that in healthcare is already shaping up to be a pretty, I hate to use the word volatile, but it may be a volatile year in healthcare, certainly depending on some of the things that Congress and Senate chooses to do in the beginning of the year. So to frame this up, in general, when we look at premiums, out-of-pocket costs for healthcare, particularly when we look at this marketplace plans, the Affordable Care Act plans, but we will probably see some spillover into employer coverage, Medicare as well. All this driven by higher medical and drug prices, plus some of these federal policy changes that are important to follow. And at the same time, we'll talk a little bit about this artificial intelligence buzzword, infrastructure. What are we using in AI so far in healthcare? Is it making healthcare more efficient? And how are we going to regulate that? So there will be some big money shifts in 2026. and we'll try to give an overview of what's going to happen there. I anticipate we're going to talk a lot about on this show and do further episodes, and that's artificial intelligence as well. So let's first look at this issue that's going on or has been going on as of the end of the year when I'm recording this episode on New Year's Eve. There hasn't been a resolution to this issue regarding the premium increases in the marketplace plans. So what's happening, particularly with these marketplace plans, the Affordable Care Act marketplace plans, is that you have probably well over 22 million Americans that are set to have subsidies that are set to expire by December 31st. And what that means is that within the ACA plans, when they were introduced, the government established these subsidies that would help people who have these plans to pay their monthly premiums. This was increased during the COVID era when a lot of people were having issues with jobs and so forth. And then it was renewed in December of 2022. The problem is that these subsidies are set to expire actually today. And as of today, there has not been a plan that has been approved by both Congress and Senate, Democrats, Republicans, to extend these subsidies. And without the extension of the subsidies, what you're going to see is an increase in the premiums. So the federal legislature is set to vote next week, January 5th, on an effort to pretty much kick the can down the road. They're looking at maybe an extension of another 2 years or so. But the reason why I bring this up is because this is something that we all need to watch and figure out what's going on. So what's been going on so far is that more people are walking away from these ACA plans, or they're switching to cheaper plans, less expensive plans that they hopefully can stay in. There are some who are just dropping their plan completely. And when you do that, this increases the uninsured population. And so we may see an increase in the uninsured. And there's a trickle-down effect from this that affects all of healthcare. This leads to more emergency room visits, more what I call catastrophic care, which tends to be pricier and more expensive. So when that happens, it drives up costs across the whole system. So even though right now we're talking about a very distinct and small bucket of healthcare plans, the ACA plans, once these healthcare costs start increasing across the boards, then the way in which other drivers, including private insurers, employer-based insurers, can keep up is that they have to increase their premiums as well. The premium tax credits are scheduled to expire, so what's called a sticker price of the insurance is going to go up, and the discount may shrink or vanish. So more people are going to be paying more, and this could be double or triple what they're paying now for the health care. And in an environment where, based on inflation and everything else, everyone is already cash strapped and things are pretty tight. We know historically that healthcare tends to be one of those things where people are more or less okay with letting things go or letting things slip. So when we face these higher costs, the insurers will assume that most of those who stay in the plans are the sickest, the people who really need health care. And that is how the insurers justify increasing the costs, making the health care costs higher, because they assume that most of the sickest of the sick will stay in the plan, therefore increasing the need for more health care costs. So they need to increase premiums across the board. So if you are buying your own insurance coverage, don't just go at this half asleep. Make sure you find a plan. If the plan worked for you in 2025, look at the increase in the premiums, look at the cost going into 2026, and make sure that the plan still works for you. And that's pretty much the safest the safest thing that you can do. If you do think that, well, this doesn't affect me, I don't have an ACA plan, I have either insurance that's being covered by my employer, or I have private insurance, these plans may not be insulated or shielded from the effect or the trickle-down effect that we'll see. So some of the data that I've found in research is that employers are projected around a 6 to 10% jump in total health benefit costs for 2026, which will then, increase the average cost per employee, roughly mid 18,000 range. And many companies may shift more to the workers via they'll shift that cost to the workers through higher deductibles, premiums, and what's called cost sharing, where you may not feel it, but you see a slow increase in premiums and the cost of your plans. I'm certainly monitoring prescription drug costs. We have these new high-priced therapies for chronic illnesses, so prescription drugs will feel this as well, and certainly monitoring, looking at the cost of drugs as well. So even if you've talked to your HR team and you have an employer-based plan and they're saying, well, we'll keep things stable, you want to watch for your copays, deductibles. You've heard me talk about this before. That's where things can go bad, when you don't realize that your deductible went from $1,000 to $5,000. So that means that if anything happens, you're going to have to pay that higher deductible first before the plan will kick in and start to cover any of those healthcare costs. So make sure you read the fine line. Make sure you read in between the lines when you're renewing these plans, and making sure things like the deductible and those type of things aren't increasing in your plan. So certainly in 2026, as we see these higher premiums across some plans and maybe the trickle-down effect, we also one of the things that I'm going to be monitoring for is a change in Medicare. The standard Medicare Part B premiums and deductibles may start rising again in 2026, and this is tied to higher spending, and so the Part B deductible jumps certainly affect a large part of the population who have these Medicare Part B plans. At the same time, we've seen drug reforms and capping of out-of-pocket of the Part D spending, which is kind of the drug coverage medication. So hopefully that cap will continue to keep pace with inflation. In relation to Medicare and our aging population, in 2026, what I'll be keeping an eye on is the math, and will there be an increased premium every month, and how much of an effect will the changes in the Part D spending will that have to on putting a cap on these large drug bills that the Medicare population may have. There seems to be a bright spot when it comes to particular Medicare, and hopefully that bright spot will continue going into 2026. So a couple of things that you can do when it comes to open enrollment, make sure that you compare plans. Don't just look at last year's plan and say that that's the one that I want to do. Look at your total costs, including your premium, deductibles, your typical visit. Was that $50 per visit, $25 or $100? And realize that if there's a plan that you may have a lower monthly payment, don't automatically jump to that and say that's the best plan. The devil is in the detail, and you want to look at the different plans and say, okay, why with this low monthly plan, what does that mean? And does that fit into my life? The amount of the medications that I take, the co-pays and so forth, and find the best plan that works for you. And if you are on the marketplace plan, check to see if you still qualify for any tax credits and how that's going to affect you and how much they may decrease or drop in 2026. Now, shifting gears to another subject that I think is going to get a lot of attention in 2026, one that if you haven't heard about it yet, you're certainly going to be hearing more and more about it, and that's the influx of artificial intelligence into healthcare. And the jury, for the most part, is still out as far as whether people think that this is going to be a game changer in healthcare, or is this something that's going to harm healthcare, or maybe a little bit of both. Going into this year, from a regulatory standpoint, the government, the FDA, has already realized and embraced AI in healthcare. They've authorized thousands of AI machine learning devices that help with everything from clinical support, which means help physicians to either work more efficiently through things like dictation and different things like that. They have technology that's helping with tools like CT scans and flagging software in the hospitals to recognize certain conditions like sepsis and stroke. So this field is so fast-paced and it's moving so quickly that is one that it's exciting to see, but it's one that we really have to monitor. And in my view, in 2026, we'll continue to see this momentum of AI and how it's going to affect healthcare. One thing we have to be careful about, though, and as a neurologist, I love anything that helps me to do my job better, to be more efficient, to be able to spend more time interviewing or talking with patients, and to be able to put my computer down or put my keyboard down and to really be able to engage patients, talk with patients, and figure out what's going on. So I embrace tools that help me find bleeds or tumors faster than the human eye will be able to see. But we have to be careful when it comes to these called black box algorithms. So that are these black box algorithms are these large programs that are created that are telling patients one thing and trying to help us, but we as the clinicians can't answer why. How does this work? How does this algorithm actually do its job? And that's one of the biggest issues with AI and its integration into healthcare, is that this is a science. This is an art when it comes to healing and taking care of patients. And so it's tough to create these programs that come in that may have good intentions to help clinicians to do their job more efficiently, to be more precise, but without really being able to answer that question of why or how does it work. That's the big difference between AI and healthcare and AI, artificial intelligence, or augmented intelligence in things like finance or other fields where you may not want to know why, or you may not really care too much of how this program can help to pick stocks more efficiently or help from a financial standpoint. But certainly within healthcare, we definitely need to see that and have that answer. One of the big issues that we definitely need to follow is how are the insurance companies or the payers going to be using AI to do things like automate claims and decisions and this prior authorizations. If the payers are using AI to make faster approvals and decrease denials, then I think that's a good thing. But what we have to be careful about is that the same tool that they are using and saying that they're using to do those things to decrease denials and faster approvals, which means that once I make an order, that patient is going to get that order done as fast as possible and without a lot of the paperwork and going back and forth that slows the process. We want to make sure that they're not using that same process against us as well to slow things down. A lot of states and regulators are moving in to figure out how we're going to govern AI. And in 2026 and beyond, from a national and on the state level, that's going to be something to really watch for, is how will we regulate AI? Who's going to regulate AI? Is it going to be regulated on the state level or on a national level? And regulators, I think, are scrambling and trying to figure that out. Different states are experimenting with different rules and disclosures regarding AI. There's certainly a lot of ethical issues when it comes to AI and how it's distributed and making sure that everyone has equal access. So certainly here in Texas, the last legislative session, there were certain parameters, certain laws passed regarding AI and making it more efficient and putting some guardrails on how it's regulated. So we'll watch how that's being implemented and how this is going to be implemented nationwide when it comes to AI and how it affects you and your healthcare. So for listeners, just some general guardrails. I think we should embrace artificial intelligence. I have personally embraced it in my clinic in some aspects. I use AI for my dictations and documentation, which in my view has allowed me to spend less time looking at my computer, making sure that I'm typing in all the information and documenting, and spending more time with my patient, face to face, hearing their story, and then allowing the AI program to take that interview, to take that information, and then put it into the chart that I can then go back and put my human eye on, trust but verify, and make sure that the visit is documented well, and that the things are in place to make sure that we can reduce the number of denials and get the patient what they need when it comes to the orders I might want to order, or the things that I want to do for that patient. So in my view, going into this year, I've embraced it, and I'm looking for other avenues, other programs, other things that can help me be more efficient in clinic, and to enhance the key thing that is at the center of healthcare, which is the patient-physician relationship. If AI can help to enhance that, the relationship that I have with my patients, my ability to be able to provide good healthcare, then I'm all for it. But I am cognizant and taking a look at how this can also affect healthcare from a negative aspect. And collectively, as a society, as a house of medicine, and from a legislative standpoint, all these issues are going to play out over time and moving forward over the next year and several years. We'll continue to see this enhanced engagement between AI and healthcare, and how we can continue to incorporate this into patient care and making our system more efficient. So 2026 is no doubt looking now to shape up into being an exciting year for healthcare. I am anxious about the things that we're seeing now when it comes to healthcare premium plans and the so-called ACA plans, and what's going to happen with that from a legislative standpoint. I do think that we're going to figure out something soon, and hopefully once the legislature resumes in D.C., they'll be able to sit down and come up with a compromise, whether it be a quick fix or something that just kick it down the road a little bit, or something more stable. But overall, we're going to need more overall in healthcare. We need to look at some of these big issues that are certainly affecting the day-to-day operation of healthcare. Things like Medicare reimbursement for physicians. When you look at, we call it the Medicare flatline, meaning that, when you look at inflation and everything else, the reimbursements for hospitals, for insurers, for pharma, even things like equipment and rent, all those things have gone up in order to keep pace with inflation. But the one thing that hasn't has been the actual reimbursement to physicians. And so that's created a workforce problem because we're having trouble attracting more people to go into healthcare, becoming a physician, and taking care of these patients. And there are certainly certain fields within healthcare, pediatrics, psychiatry, and so forth, where they have lower reimbursements, again, where we're having trouble really getting physicians to go into these fields. So we need to fix that problem. We need to work on that and make sure that physicians are taken care of, that they are economically on equal footing with everything else that's going on with the world, and that reimbursements are able to keep up with inflation, to make sure that we have the physicians to be able to take care of people. Because in the end, that's what it's all about. This year, no doubt as well, we're going to see an enhancement in technology in healthcare, everything from artificial intelligence to other tools that hopefully will help our workforce, our physicians, to be more efficient, to be able to run practice more efficiently. And so we'll certainly keep an eye out for that and how that affects you as a patient. How's that going to affect your doctor visit? What does that mean? I certainly don't think we're anywhere close to the day where you're going to go in and be meeting with the AI bot rather than a physician. But certainly everyone is going to start seeing artificial intelligence and technology being integrated more and more into their health care. And so that's something that we'll certainly have to monitor. So I'm along for the ride, and hopefully with this podcast, I can continue to provide the type of information that will help you take this journey with me. And as we flow through 2026 and into 27 and 28, healthcare, like all other industries, is going to have its ups and downs. But together we'll be able to navigate this and make sure that we continue to have the best healthcare system in the world, and make sure that it's doing what it's supposed to do, and that's making sure it's taking care of the patient-physician relationship and our ability as a country to create innovation, to stay at the forefront of healthcare, and to be able to take care of people. I'm, again, excited for 2026. Stay tuned for future episodes, and we'll dive deeper into these subjects and many more. So please stay tuned for future episodes. Please share with friends and colleagues, and look forward to talking with you more at the next episode of Your Health, Your Wealth.